All right, so thank you everyone who was able to join tonight. Somehow I managed to leave work, drive to Rock Hill from Charlotte, get home, get both kids fed, both kids bathed, and the youngest asleep and ready to be here for this presentation. And I still don't know how that happened, but if you see a 5-year-old running around in the background, there is still one awake. So I apologize about that. But I'm sure many of you are in the same situation as you're trying to find some time this evening to join and listen. And I hope you did. We are very thankful to have Stephanie here this evening. I was just thanking her when she joined for jumping almost immediately to volunteer and participate in this. And she's going to be talking about a really big topic tonight of parenting the neurodivergent child. So with that being said, Stephanie, thank you so much. And I'm going to pass it over to you.
All right. Hello, everybody. And thank you, Carrie. And thank you, John Crosland School, for hosting this series and also allowing me to present. I'm very excited to speak with everyone tonight. So first, I'll just tell you a little bit about me. Again, I'm Stephanie Goodson. So I'm a psychologist in Charlotte, and I own a private practice called Clear Foundations Therapy and Assessment. We specialize in testing and therapy for children and adults with, well, at least my area of special interest is in supporting neurodivergent teens and adults as well as their parents and helping teens and young adults transition to adulthood. At least that's in my therapy life. Testing, I test kids anywhere from age 4 to adults age 64. So tonight we're going to be talking about just general parenting topics and issues with working with a neurodivergent child. So when I started developing content for this presentation, I realized how huge it is. So I ended up focusing more on just parenting strategies through the presentation, and I feel like we could probably pull out 4 very long presentations with this. So if at the end anyone wants more information or would have liked to have heard something more about a specific portion of the presentation, please let me know. So first, we're just going to do an overview of what is neurodivergent. We're going to talk about the neuroaffirming movement. What does neuroaffirming mean? We're going to talk about diagnosis. Before a diagnosis happens, what's the importance of a diagnosis? And after getting the diagnosis, what are some actionable steps? We're going to talk about advocating for ourselves, our families, and our children, as well as just some general parenting strategies and touch base really quickly on how those will look and change in middle school, high school, and adulthood. So a quick note on this, every child is unique. The strategies that I'm going to talk about today are really research-based, also based on my clinical experience and my personal experience, but they're definitely not one-size-fits-all solutions. Please talk with your therapist, your OTs, whoever you're working with, to make sure that anything you do is really tailored to your family and your child's specific needs.
And Stephanie, I'm going to jump in just for a second. I'm so sorry to interrupt. But one thing that I did not say that you mentioned is if anybody has any questions as she's going through this awesome presentation. And by the way, we just, as a community collaboration series, I feel like never get enough tapped into the older ages. So I'm really excited to hear that specifically. But I'm going to be monitoring the chat. So if you have a question that you don't want to leave your mind and you want to drop it in the chat, please do so, or you can jot down your questions and I'll stop the recording closer to the end of her presentation so that you can freely ask your questions then. Thank you.
Yeah, thanks, Carrie. And also to let you know, any resources I mention or not mention, I will have a QR code for you to scan at the end of the presentation that will take you to a resource sheet or a resource file with all that information. All right, so my why do I do this? So I became a psychologist in 1998. I've been licensed here for a long time. I've done different things over the years, but I really became interested in working with neurodivergent folks after my oldest son, Andrew, was diagnosed with autism when he was in the 7th grade. So we had adopted Andrew from Russia when he was 18 months old. He was this super cute little blonde bundle of energy. And hopefully next time I do this presentation, we'll have his picture here. So, but when we got him, he had super advanced verbal skills. He constantly talked. He was constantly on the go. The orphanage director, when we were in Russia, told us 2 things about Andrew. He said, number one, or she said, number one, you're very lucky to get him. He's very smart. And the second thing she said was, his nickname is the little boss. He likes to be in charge. So we thought that was so funny and so cute at the time. We thought, okay, he's just this genius little boy and a future captain of industry because he likes to be in charge. And, we, looking back, that was clearly our first indication that he was autistic. So we brought him home. And again, there were some signs pretty early, but we were first-time parents. He was adjusting to a new family, a new country, a new language. We didn't really worry too much or seek out help those first years. When he started kindergarten, we started therapy then, and he was diagnosed with reactive attachment disorder. So we went to therapists and who said, okay, we've got to do behavioral interventions with this kid. You've got to be consistent with the consequences and the rewards and set those firm limits, and he's going to be okay. We had several other therapists who told us the same thing. And I really believe that. I believe that method. As a psychologist, that's what I was trained in, is behaviorism, that it's shaping behavior and changing what someone does. So, found out later, and that's kind of what I'm going to talk about now, is that just really didn't work because we weren't getting at the why of the behavior or kind of what was behind it. So we really muddled through and did all the wrong things until he was in the 7th grade. And at that point, we were able to connect with this amazing therapist in Charlotte who looked at me and said, I don't think your son has reactive attachment disorder. I think he's very attached. She said, have you ever considered autism? And my immediate reaction was, well, yes, I absolutely have. At the time, we had talked to a lot of different providers and, brought it up to his physician and therapist. But my knowledge of autism at the time was very limited. And what I did know about autism was mostly wrong. And when I had brought it up to his providers, I heard things like, he's too smart to be autistic. I was told that his behaviors were related to his advanced intelligence. I was told, just to teach him to act like everyone else, repress his stimming, that he needed to learn to make it in the real world. And I was told to take this wait and see approach so he might grow out of it. So until we saw, the right therapist in 7th grade, we were doing all the wrong things for Andrew, the wrong pairing, the wrong therapy, because we were using the wrong assumptions and the wrong diagnosis. So that therapist referred us to a psychologist to get a psychological evaluation, and that really changed our world with Andrew. It gave us clarity. It gave us a better understanding of who he was and what he needed, and it really set us on the right path to supporting him. Now, that path was still very rough and bumpy, but at least at that point, we were in the right lane. So we had the correct diagnosis, but even as a psychologist myself at the time, it was extremely difficult to find people in the area who were trained and knowledgeable to provide him with the support. And at the same time, I was still trying to learn about autism and educate myself. So I would like to say that after learning of Andrew's diagnosis, I became that perfect neuroaffirming and patient mother. But unfortunately, that is not what happened. So, I found, and as many of you know, raising a neurodivergent child is very hard. It takes lots of energy. It takes learning a whole new way of parenting than you were taught. It takes advocating for your child in a world that does not understand neurodivergence and does not easily change to fit your child's needs. I was really scared for my child. I was angry at everything. I was tired, and I felt really helpless. And that affected my parenting. So don't get me wrong, I had moments of mom greatness. I did magical holidays. I put together great birthday parties. I loved my kids fiercely, and they do have lots of fun childhood memories. My youngest son just went to college in the fall, and he's doing great now. But he was by no means easy to raise either. I'm happy to say that they're both thriving now, but they were difficult. It was hard to parent those two boys. One of them was adopted, one of them was biological, and when I looked at the situation, I thought, okay, what's the only common denominator between those kids? They don't share genetics. It's who raised them, right? It was me. It was my husband. And I really felt like, oh, it must be our fault. We did something wrong with both of them. So I just carried lots of mom guilt about the mistakes I made. But here's what I've learned through raising them and through, specializing in testing and supporting neurodivergent families is that for the most part, your kids are going to be who they are. Except in extreme cases, we are no more responsible for their negative traits than we are for their positive ones. However, with the right knowledge about their needs and understanding the why, when, what, and how of raising kids who are differently wired, we can usually do better as parents and make things easier for our children and a whole lot easier for ourselves. So that's my why and a little bit about me. So next, let's talk about what is considered neurodivergent. So neurodivergent refers to individuals whose brains function differently from what is considered typical or neurotypical. So they have differences in brain development and how they process information, and these differences can show up in how they interact socially, their learning style, their attention, executive functioning, mood, and just other multiple mental functions. So it's estimated that about 10 to 20% of people worldwide are neurodivergent. And in the United States, about 2.21% of adults are autistic. So I will talk a lot about autism today because that is my personal experience. My son, also very ADHD. So about 50% of kids who are diagnosed with autism also have a diagnosis of ADHD. But some of the other most common conditions or differences that are considered neurodivergent are, again, autism, ADHD, intellectual disabilities, giftedness, and different specific learning disorders like dyscalculia, dysgraphia, dyslexia, and dyspraxia. And there are more, but those are the ones that I see commonly in my practice. All right, so neuroaffirming. What does neuroaffirming mean? So when you take a neuroaffirming approach, which I do, we view neurodivergence as not a disorder, but rather a natural variation of the human brain and part of the human neurotype, natural variation in the human neurotype that should be respected and looking at them again as not a disorder, but as differences. So just like we all have external differences that are more obvious, like our height and our hair color, we have significant differences in how our brains look, how they connect, how our neurons connect, and how they communicate with one another. So being neurodivergent is not good or bad. It's not normal or abnormal. It just is. So when we take a neuroaffirming approach to parenting or helping neurodivergent folks, our goal is to, instead of forcing them to change and conform to neurotypical norms, we try to understand what each individual person needs and support them in a way that we can fit their world to meet their needs, not force them to change to fit the world. I love the analogy of the house plant. So if we have a house plant that's dying, how can we help the plant? We don't yell at it. We don't put it in timeout until it starts to thrive or tell it to try harder. Instead, we find out what the plant needs and change its environment. We look at, does it need a larger container? Is it getting too much or too little water? Is it getting the correct nutrients? We basically change that plant's environment to fit its needs. We don't tell it it's wrong and it needs to change. Another example I like to tell is my friend who is 5 foot tall and I'm 5'9". We're quite a funny pair, but there's a lot of things she can't do because she's short, right? She can't reach things on the top shelf. When we're like cooking in the kitchen and she's trying to reach something on the top shelf, she can't get it, right? And I'm not going to tell her she's lazy or she's not trying hard enough. I'm not going to shame her. She is just not going to grow taller. She's just not going to get that extra 9 inches. So I go get her a step ladder. I get her what she needs to help her so she can do the job. All right. So what's the point of a diagnosis? So I hear this a lot from parents. I'm afraid of labeling. I'm afraid of getting this diagnosis, right? And I just want to say a diagnosis is not a label, okay? And to kind of go back, some of that worst advice I've ever received with my son was the let's wait and see advice. Let's wait and see. Let's wait and see if he grows out of it. And that's what we did. And in those wait and see years, here's what happened. He was continually socially rejected, and he didn't understand why. He became very anxious and depressed. He missed invaluable early intervention like occupational therapy to help him with his sensory processing, emotion regulation, and his executive functioning skills. Again, like I said, he was given multiple therapies that were wrong and made him worse. We were given parenting advice that increased his anxiety and, quite frankly, traumatized him. So, and out of fear for my child and kind of desperation of helping him and wanting to know what was going on, I shamed him. I punished him for his autistic traits. I tried to change him to better fit into the world. I yelled, I was punitive, and I was often very mean. I treated him like he was bad and like he was making a choice to be autistic in the way he acted. So, since then, and since my journey of understanding autism and becoming neuroaffirming, I've tested many adults and diagnosed them later in adulthood with learning disorders, ADHD, or autism. It's pretty powerful because their first reaction is always feeling really validated and also very sad. And they say, I wish I had known sooner. My life would have been so different. And they really have to grieve for not knowing and for the hurt they've experienced because of that. They feel with that diagnosis, they have relief, they feel empowered. And after for years and years of being told you're lazy or not applying themselves or that they're just weird, and that's why they have they feel this social rejection. Because for years, despite their best efforts and trying their hardest, they just were never able to meet neurotypical expectations. And then they find out, well, really, I wasn't doing anything wrong. That's just my neurotype. That's my brain. And they find that there's a whole new group of people that they belong to who have the same experience. So diagnosing is not about labeling. It's about empowering someone with information. The diagnosis does not change who they are. They already have that way of looking at the world. The diagnosis just protects them. So I encourage every parent to have a clear understanding of what's going on with their child. If you see a developmental lag in your child, especially in the early years, you don't necessarily need that initial diagnosis to get a little extra help for your child, but do get the intervention. If there's a speech delay or articulation problem, address it head on. If your child reacts negatively to sensory things or screaming, refusing to brush their teeth, take them to the OT, occupational therapist. Early intervention is important. Don't miss that important developmental window while you're in that wait and see mode. Because if they are neurodivergent, you don't grow out of that. You don't grow out of neurodivergence. And think about it. What will you regret more, acting or not acting? What is the gamble you're willing to take? Plus, intervention can be super fun for kids, especially if they meet or get connected with a provider they really enjoy. All right, so diagnosis achieved. That's a phrase my sons use all the time. Whatever they do is achieved, dinner achieved. So you get the diagnosis, now what? We all have different reactions when our child is diagnosed. Maybe you're surprised, maybe you expected it, and it was really validating because you've worked really a long time for answers. Maybe you were angry with the person who diagnosed them and said, no way, that person's wrong. Self-blame. Did I cause this? Did something I do during my pregnancy cause this? Is it me? Is it my genetics? Am I autistic? Do I have ADHD? I know I had learning disorders. Maybe you were really sad and just needed to grieve. I know when my son was first diagnosed, I had a real grief reaction. It's kind of a bittersweet confirmation of what I already really knew. And now that he's an adult and I've worked hard to understand him and autism and accept him for who he is, I don't really remember or understand why I was sad at the time. I think I was just really afraid that he was not going to be able to live a normal life, but he does live a normal life. He's just different than I expected. It's a bit different from our family tradition, and kind of what most of us do, go to college, get your degree, those sort of things. But he's happy, he's successful. I love him, and we have a wonderfully close relationship. It just took some flexibility and reimagining what was okay and what was normal. So when you do get the diagnosis, the first step is to give yourself some time to grieve. Connect with other people who understand, even though we're neuroaffirming and we know we're going to love our child for who they are and that being autistic is okay. We all dream of having children without struggles or differences. So it's not what you expected when you dreamed of having kids. So it's okay to be a little sad. It's okay to grieve. So reach out to people who understand. Don't be surprised if a lot of your friends and family aren't supportive or just don't understand what autism is or don't believe your child is autistic or ADHD or learning disorder, just whatever it may be. So to your child, don't show that grief. Don't show that sadness. keep that really to yourself, because you need to approach your child differently, and we'll talk about that in a minute. But do find your tribe, do find your support out there, who people who really get it and who've walked in your shoes. So there's lots of great local Facebook support groups for parents of neurodivergent kids, and a lot of therapists occasionally have support groups for parents. I'm not going to mention any now because they seem to kind of go in and out. I know I myself had one for a few months for teens and young adults, for parents of teens and young adults who are neurodivergent, and that's something I want to start up again, but it will probably be first of the year. So just look around and find those Facebook groups and find parents, and they're a great source of connection. Next, educate yourself, read books, audiobooks, listen to podcasts, go on the websites, make sure they're neuro-affirming resources. So positive resources that are going to give you advice that doesn't traumatize and hurt your child. And again, I'm going to give those resources to you, and they will be listed in the resource sheet at the end. Practice self-care, go on trips, get babysitters. Other people can help you. They may not be perfect, but they'll be fine for the time you can get self-care. Trust your spouse to watch your child. A lot of moms especially feel that control and like dad can't do it, but dad can do it. Dad may do it differently, but that's actually good for our kids in a lot of ways. So trust your spouse, trust people, give yourself a break. Want to who to tell and how to tell. So again, present your diagnosis to your child in a positive manner. Not like I have this bad news to tell you, I've got to break this to you, but it's like, oh, we found out more about how your brain works and how you think, and this is autism, and this is what it means to you. Work with a neuroaffirming therapist about how and when to talk to your child. I think children deserve to know the diagnosis when they are ready. They need that validation. They already know something's different. And I just think it helps prevent anxiety and depression and different problems that can develop down the road. Talk to the child's school, discuss their child's needs, get academic supports. Share the information with anyone your child spends a lot of time to, explain the why behind their behaviors and how to best respond and support them. I want to touch on parent shaming. So parents of neurodivergent children constantly shame, look down on, judge, and constantly given advice and conventional wisdom about parenting. We get it from our families, other parents, the schools, even some mental health professionals and doctors who just really don't understand what being neurodivergent is. We're accused of poor discipline, not teaching our child manners. You hear those, he needs a good spanking. His parents let him by with murder. They don't, give him any consequences when he misbehaves. A lot of times moms honestly seem to get the worst of the blame. We've been accused of even causing autism in the past. We're either too permissive or we're helicopter moms. We can never seem to get it just right. When our child was diagnosed, we had 2 sets of grandparents, and they had very different opinions about our parenting all throughout his childhood. I had one set of grandparents who said, you let him by with too much, you need to teach him, you need to give him consequences, you need to be more firm, he needs spanking. I had the other set of grandparents who said, you are too tough, you are mean, you need to back off, what is going on? 2 complete ends of the spectrum. And, I was not going to get it right. I was never going to please anyone. And I did absorb those things. I think as parents, we already feel so out of sorts, so helpless, worried, guilty about how we react, because we're not going to be perfect no matter what. And we absorb those things. What people say hurts. We're really sensitive. I mean, parenting is the most important job that we'll ever do. And I think a lot of times when we're raising differently wired kids, we feel like we're always screwing it up. So those out there who have neurodivergent parents in your life, be careful what you say, be supportive. And I just want to tell all the parents out there, it is not your fault. And your child is going to be okay. They will be okay. All right. So taking some of that shame and advocating for your family and for your child. So the first thing is separate yourself from the opinions of others who criticize and shame you, your family, and your child. Their opinions are not fact, and you do know better than them. I've heard people say, oh, that child may be autistic, but that's no excuse. Or, he may have ADHD, but he still needs to work harder and apply themselves. And what's really happening with most of these kids, especially ADHD kids, they're working harder than anyone else. And it's not working. And that takes a huge, huge hit to the self-esteem. Then kids, it causes anxiety, depression, or just kind of causes them to give up. So separate yourself from the opinions of others. No one is going to understand your child the way you do. And you can try to spend a lifetime educating these kind of naysayers, these critics, families, family members, or friends, and they just may never understand. Also, try to give them some grace. And I know that that's very hard to do and forgive them. So what I do recommend is developing a handout about your child, about this is my child, these are their needs, when they behave a certain way, that, when these needs aren't met, this is the way they behave, and how that person can respond. And that's great to give to neighbors or, parents for play dates or grandparents or schools. It's just good to have that. Advocate for your child's needs. Remind everyone they're an individual. They don't have to act like everyone else. They don't have to learn to live in the real world, because they are going to live in the world. They are going to be successful, but only if they learn to honor their needs and make the world fit those needs, okay? Or arrange their world in a way that meets those needs. So statements. I like to call these advocacy statements. When someone is not really recognizing your child or helping your child in the way they need to be helped. So first one, my child has a neurological difference that affects how they interact with others. They are not misbehaving. They are not bad. Your child is not bad. They have an unmet need. And the second one, when my child got diagnosed, I had one very important person, won't mention names, say, autism, we don't believe in any of that. He just needs discipline and needs to be taught. So, and you hear that sometimes. Sometimes I've diagnosed kids and they go back out into the community or to their doctor or to the school and they say, oh no, they're wrong. This child doesn't have autism. We work with lots of kids with autism and this isn't it. And that really is terrible for the parents, because they work so hard to find answers and they're immediately invalidated and denied. So here's what I tell parents. This is a statement: regardless of what you believe, these are my child's needs, and this is how I expect you to respond when you are around my child. And just stick up for what they need. You have that right. You don't need someone's buy-in or belief to give your child what they need and treat them the way they need to be treated. So let's address some parenting styles, some parenting approaches. Talk about what doesn't work and then what is more likely to work. So again, we talked about the traditional rewards and consequence parenting, and that conventional parenting wisdom often does not work for our kids. It can make it worse and can really backfire, counterproductive. So what are some things that don't work? First one, timeouts. So, timeouts are used to give children a break from a situation where they're misbehaving, with the idea that this time alone will help them calm down and reflect on their behavior. What timeout is really is a punishment. The isolation increases their anxiety. They may not even realize why their behavior was inappropriate. They may not have had the skills to really self-regulate. And if you send them into the timeout corner to self-regulate, it's probably not going to happen if they don't have the skills to calm themselves and regulate their emotions in the first place. The second one is telling them to try harder, just push through it, act like everyone else. You can go on with those statements. So encouraging children to push through challenges and try harder is often seen as a way to build resilience and perseverance. And there's that common statement, what doesn't kill you will make you stronger, but that's really not true. What doesn't kill you actually leaves you more vulnerable to illness, disease, and hopelessness. So don't tell them to ignore their needs and push through it. Look me in the eye. So some people confuse eye contact with understanding and respect. A lot of kids who are neurodivergent, looking at someone and listening to them cannot happen at the same time. They can do either or. They have sensory overload, trying to navigate your facial expressions, your tone of voice, and then the content of what you're saying. They often can't do it at the same time. So never ask for a child to give you eye contact. They can show understanding in alternative ways. Punishment in general. Punishment for misbehavior is seen as a way to deter future misbehavior. But again, where that backfires, it's kind of promoting this anxiety response that kids have. So what does work? And, talk about punishment increasing anxiety. So there's a few authors that I'm going to tell you about that I think are very, worth your time. To help you kind of understand your kid and start to change the way you approach your child. So the first one is Robin Goebel. She wrote a book called Raising Kids with Big Baffling Behaviors. And she talks about misbehaviors really being rooted in anxiety, fear, and even trauma or trauma-like response. So when we talk about the brain, our reaction and our emotional response is based, primarily in two areas of the brain. So the first one is this midbrain, or what we call the limbic system. And that part of your brain, kind of evolution-wise developed early kind of in our development as a species, and also develops earlier in your brain as we grow. So the second part of the brain is this frontal cortex. Okay, so that is a little bit slower to grow and really continues to mature well into our late 20s and make connections. So your limbic system, that is registering danger. Okay, and that gives you that fight or flight response. Okay, I'm in danger, I need to protect myself. When it registers danger, it can send info down here to this part of the frontal cortex that allows you to apply meaning to it. Okay, so is this really dangerous? What can I do? What are some alternative explanations for this fear I'm having? And allows you to kind of apply reason to what you're feeling and to think before you feel, so to speak. So a lot of times when our kids are misbehaving, they're really stuck in this midbrain or this limbic system. And Robin Goebel referred to this as the downstairs brain and the frontal lobe as the upstairs brain. And, the downstairs brain are survival instincts, right? That's what causes us to fight, flight, freeze, or fib. So when kids lie, a lot of times that's that fear response, that self-protective response. Okay, so she says our goal is to help kids transition from that downstairs brain to that upstairs brain. So when they're stuck in anxiety and trauma, sometimes that's hard for them to do. And the other piece is that a lot of times they may not have the neural connections or brain development really for them to effectively use that upstairs brain yet. So our goal is to help them get out of it and also teach them and afford them the opportunities where they can develop and use that upstairs region of their brain. So some strategies to do that. So create a safe environment for them by keeping, things as predictable. Give them a schedule and use visuals to help them understand that schedule. Calming techniques like a sensory toolbox with stress balls, weighted blankets, anything they might need, and in a bag that they can carry with them and access as needed. The second or the third thing, co-regulation. So stay calm. If your child is reacting in a meltdown, stay calm, and they can use your own calming presence to help them regulate. Speak gently. Speak validating phrases. I understand what you're saying. I understand how you feel. I know this is hard for you. I'm here with you. You're safe. We call this time in sometimes, right? Be there with them. Give them time in. Co-regulate with them. Sometimes being there and trying to talk to them at that time can make it worse. But just be around, be calm, don't yell, don't use that time to teach the child or explain what they did wrong or what they can do better next time. Don't give consequences. They're not going to be able to register it, and it's just going to fuel that meltdown and make it go longer. So wait for later for that. Use mindfulness and grounding exercises. So there's a lot of different ones. A lot of us know that. Name 5 things you see, 4 things you hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste. I love the rainbow walk with kids. So have them have a notebook, and kids, teens, adults, we can all do this. Walk around and name as many things as you can that are the color of the rainbow. So have your Roy G. Biv written down and just tally things. Or if that's too much, just pick one color. If it's not safe to take them outside, do it inside. Pick one color, do kind of a mini I Spy. How many red things can you see in this room? There's a warming hands method that I really like, imagining and feeling your hands warm, sun on your hands, or holding a cup of warm tea, whatever it is that can warm your hands up. And it's pretty powerful. And, letting them feel that it's calming, rubbing your hands together, putting that hand to your heart, letting that warmth radiate through your body. My 5-year-old niece taught me this one yesterday. So we were eating lunch and she drew a river and she said, draw as many fish as you can in this river. And I knew right then, I said, I'm going to use this in my presentation tomorrow. It was a great one. I drew like lots of different colored fish and different shapes. And but you can also use that as a visual meditation. Imagine the river, hear the water, feel the breeze, imagine what fish and visualize them floating down the river. You can use Headspace for kids, the Calm app. All those are good resources. Know that sometimes neurodivergent folks have trouble visualizing those things and may need a more physical, tangible centering technique. Use positive reinforcement, not for necessarily when they do something good, but for when they use that calming technique, whether it helped or not. Praise them later, not in the moment, because that could just fuel them for using that technique. When you are using praise any small act, even if it's expected of them for their age. A lot of times neurodivergent kids are just constantly hearing negative messages, and to get anything positive can be so powerful. And to really change, you have to build off that positivity and grow. So take every opportunity to praise. And as a parent, celebrate everything, because sometimes it's hard to feel that win with your neurodivergent child. Deep breathing techniques, the belly breathing, but also I like this little bubble breathing for kids. So just have them take in a deep breath and blow several bubbles out like they're trying to blow a bubble. So it helps kind of regulate that breath and calm them down. Use visual supports, visual schedules, social stories, or at least to explain kind of what's happening next and what's coming. And there's some apps I'm going to share with you too that you can do with that. Physical activity and movement, jumping, trampolines. They need that brain break. It helps them regulate emotions. It helps kind of control those executive functions, improves attention, in the moment. So at least gives several breaks and movement breaks during the day. Encourage nature time. I love barefoot on the earth time, shoes off, feet on the grass. It's effective. Yoga, family walks, watch your nutrition, keep sleep as consistent as possible, whole foods, limit sugar. Sometimes that diet's super hard with our kids because they have limited diets and restrictive food interests. So consult with a dietitian or a feeding specialist who knows how to work with kids. I think that's just a huge important aspect of a child's life and one of the biggest battles we have to face daily with our kids. Address sensory needs, and this of all things is probably one of the top causes for meltdowns, overwhelm, shutdowns. Know what your kids' sensory needs are. Give them opportunities to care for those sensory needs. Whether it's headphones or loops for older kids, or letting them wear the same, outfit every day because that's sensory wise what they can manage, do it. Provide what they want that they have a sensory preference for, whether it be weighted blankets or fidgets or whatever they need. All right, so parenting, different models of parenting that can be helpful. So Dr. Ross Green, he's kind of the OG. He said, kids do well when they can, that kids are inherently good. They want to be good. And when they can't, it's because there's a lagging skill there or a need unmet, and that it's our job to figure out what that is. And, this is the one thing that really changed my parenting trajectory. I had a therapist just casually throw out this quote to me one time in one of our family sessions. And I'm like, who's this Ross Green dude? So I started reading his book, and it absolutely changed the trajectory of my parenting, calmed our family life, and was just invaluable. It changed my life. So basically, he said that you want to engage the child proactively in understanding the problem, identify their unmet needs, their lagging skills, and involve them in finding the solutions. So just choose a couple things. You don't need to solve everything. Go to the child and say, this is happening. This is why it's a problem. What do you think's going on? How do you think we can change this? Don't do it when they're upset. Do this again proactively when they're calm. This approach is great because it helps build skills for flexibility, to manage frustration, to solve problems. It helps them develop those reasoning skills, and it gives them intrinsic motivation versus that extrinsic motivation. So I want to do this because this is something that I want to solve, and I came up with the solution with my mom and my dad, or my parent or my guardian. And this isn't just like them making me do something. This isn't just a punishment. Ross Green has, again, The Explosive Child, the book, and he's got a great website that has resources for parents. So using these techniques, we're getting that kid out of that downstairs brain, that animal brain, right? That old brain that is just fight or flight, and trying to get them into that upstairs brain where they can calm and reason and regulate. So another type of parenting, and I can't see you guys, but I imagine there's a lot of eye rolls right now. Low demand parenting. So this one gets a lot of criticism. It's really just kind of a form of raw screens parenting, but style, but low demand parenting. So instead of like going harder and being firmer when a kid is misbehaving, let's back off, right? Let's be a little more relaxed. Let's quit imposing all these demands on them that they can't even meet and that they're overwhelmed. And let's look at helping them again regulate, emphasizing discipline, schedules, and adherence to rules are kind of the traditional things, right? But in contrast, we're emphasizing flexibility, right? Flexibility about, okay, these are the routines and this is what we need to do, but we know sometimes things happen, right? So we want our kids to be flexible. We have to be flexible too and model that. So give them a little freedom to set their own schedules when they can, reducing pressure, emphasis on autonomy and independence. And really, this is the goal, right? We want our kids to be able to do this on their own, to intrinsically do the right thing and manage their behavior and get themselves up for school and make right decisions. This is responsive rather than directive. And looking at supportive environment and developing your relationship and connection with your child. So it's really important to know that this is not about being a permissive parent and letting kids get away with things. Okay, it's not removing guidance. It's about balancing needs for structure with their need for autonomy and providing support at the same time that you're reducing that pressure. So this is especially beneficial for kids who do thrive in less structured environments and experience anxiety and stress and high pressure. May not be suitable for all children. Again, reach out, get help if you think this might be something that would work for your family. In general, as parents, we need to let go of those musts, the shoulds, the perfectionism, reduce their stress and yours, and these parenting approaches will help that. I want to have one little discussion about declarative language. So making statements that are just kind of observations versus orders. Okay, so instead of saying like, turn off your phone and do your homework right now, it's like, I've noticed your phone is pretty distracting. How do you plan to manage your homework time? Again, looking at that independence and kind of putting that decision making on their shoulder, getting them out of that anxiety reaction. This works well with pathological demand avoidance or the persistent drive for autonomy. A lot of our neurodivergent kids have that profile. And what looks like defiant and bad behavior is really just an extreme anxiety reaction, that anxiety-based need for control. If I'm not in control, then something bad is going to happen, right? I feel anxious. So avoid giving those directive orders. Make the declarative statements. There's the declarative language handbook I recommend, and that is also in the report or in the resource sheet. All right, social needs. So now I feel like we're finally getting to the teen and the adult part. I'm sorry, I've kind of not given a lot of time for this, but again, maybe that's another presentation. So social needs, make sure to the best of your ability, match their activities to their interests, their cognitive abilities, their processing abilities, and their sensory needs. So not forcing the kid who doesn't like crowds and is really sensitive to pain to go play team basketball or football. Avoid forcing them to conform to neurotypical social standards. They don't have to act like everybody else. Find people who appreciate them for who they are. And sometimes that's a small few. If they're 17, they still love the Legos, let them enjoy it. Let them go out and find Lego lovers. Organize social activities to match your child's interests. A lot of girls, we love those horses and the animals. Get them involved in horse riding, volunteering at animal shelters, doing goat yoga. Whatever that they love, let them go for it. Let them arrange social interests around that. I love activities versus just kind of sitting around and talking. Activities where you have the same goal. They're kind of team sports but individualized. Things like swimming, tennis, rock climbing, gymnastics, martial arts. Again, you got to consider your child's sensory needs and also their physical abilities. In middle school, they're going to continue to need support. At that point, we're hearing a lot of messages from the school, and we also feel a lot of pressure that it's time to back off. It's time to let them be independent. They're never going to make it in the real world if you don't. So, that's not necessarily true for our kids. Meet them where they're at. They're going to have different needs. They're going to meet those milestones and that maturity level at different times. Social demands are going to become more complex. It's going to be harder. A lot of times this is the age when our kids are first diagnosed or observed because they can't manage socially anymore. They suddenly start losing friends and we see depression and anxiety. So continue to advocate for your child's needs. Give them that extra support if it's needed. It's okay. Don't give in to that pressure and shame of the shoulds of being independent at that time. Do start trying to engage them regularly in decision making about classes, their free time, resolving problems at school. They may or may not have a lot to add, but know they're a part of it. Slowly start to talk about what's going to happen after high school, planning for that. Assess their fears and concerns about that post-secondary life. Validate their fears and discuss some solutions. Explore post-secondary programs that develop job skills related to their interest. If college isn't for them, fine. There are job training programs and areas of support out there. There are colleges that support neurodivergent learners. Start looking at that. What colleges have a major that fits your child's interests? So again, careers, college majors, it's got to fit their interest. If it doesn't fit their interest and it's not something they enjoy, they're much less likely to be successful at it. I'll just give the example of my son. He always loved emergency services and rescue folks and medical information, and I thought, okay, yeah, when he was 2, he said, I want to be a cardiologist or a neurologist. I can't decide. So I really had high hopes. And he's such a smart kid. He really is. But he loves that emergency services, not crazy about school. So he works as an EMT now, and he is the best EMT you'd ever see. Like if I ever need an ambulance, I'd want him there. So he's great. He's happy. He's doing well because he followed his interest. And again, not kind of that college degree that I expected, but it doesn't mean he won't get there. Okay. At that time, start looking at, okay, do they need updated testing for college accommodations, those entrance exams, or even job accommodations? I get lots of calls like, oh, my kid has to turn in this request for accommodations for the ACT in 2 weeks. Can you finish this? And no, it's really hard to get that ahead of time because a lot of people, are scheduled out for months. And then it takes a while to get that done after you start testing. Life after high school, when they are done, encourage and let them be as independent as possible. If it's a viable solution, find a way for them to be outside of your home. Find a way for them to live with someone else as an independent adult or on their own. seek the informal supports from non-family members, such as peer mentors, neighbors, to help them develop their own sense of being an independent, competent, capable adult. It's super important for them to get away from mom and dad and know that they can do that. And for us as parents to be able to relinquish some of that protective drive we have and know that even if it's not perfect, it's going to be okay. That we can give them independence with extra support, just like we did through middle school and high school. My son moved out. We knew he had to get out of the house to be independent. We knew he needed his own apartment. And for 3 or 4 months and for a while, we paid for that apartment. We helped him. But we knew if we impose that rule, well, you can't move out till you can afford your own place, until you can pay for your car and pay for your own gas. That was an impossible goal for him. And he would probably still be in our house versus the thriving, successful person he is now. So give that independence, give support, and slowly pull away on those supports as you can, as they're ready. Be okay with their mistakes. They may continue to need lots of support and reminders. They may need a list of what adults need to do in the year that we always did for them before, that you go get that physical, you go to the dentist twice a year, and they might need reminders that you do have to pay your bills once or twice a month, how to organize those. But again, you can start teaching some of those skills in middle school and high school. Be okay if they don't shower for a few days. They might not. Be okay if they don't cut their nails for a long time. They might not if the teeth don't get brushed, if their house is messy. Again, all those things are distressing. They're not dangerous, and they're not permanent. They will get it. They need time to emerge, and they need time to figure it out on themselves with support. So be flexible, be supportive, be encouraging, be persistent, and be patient. So this is the QR code to the resources handout. And if there's anything on there that, or any more resources you want, or I didn't mention, feel free to reach out to me. I'm glad to give you what I have.
Thank you so much. And
Yeah.
the whole time you were talking, and this is just my personal takeaway, but I just kept going back to that very early example you used of you and your friend and your height difference, and
Yeah.
how you didn't shame or yell or criticize her for her size, but you also didn't reach to the top shelf and get it for her. You got her the
Right.
step stool. And so
Right.
all of this presentation was that exact thing of how can we find that step stool in an affirming way for these children. So I don't know, just the whole time you were talking, it might be the previous English teacher in me going back to that example, but that was just really meaningful the entire time. So thank you so much.
Sure.
I am going to stop the recording at this time and open the floor for any questions that anyone needs. But before I do that, I just want to thank you again for taking the time to share not only all of these great resources, but also your personal story with us tonight. So thank you so much.
Thank you.